Stop that.
Okay, how's everyone doing? You guys hear me okay?
Yes.
Okay,
We got
awesome.
you. And
Good
Teresa,
deal.
you're on mute, just letting you know in case you hadn't noticed.
Thanks. I was just sitting quietly in the background.
Good evening.
Well, we've got about 4 minutes till we officially start.
Okay.
So remember, you are being recorded, so try not to say anything that you don't want recorded. I think that's a reasonable thing to say.
Wait for the rain. Took the 2 grandkids down to the pier today, and it was cold.
Oh, I saw pictures out there about how beautiful it looked.
Oh, it's awesome. The waves are huge and just churning, and the wind's blowing, and the birds are, what's up with this?
It's so chilly.
And we stopped at Handel's and got ice cream in the freezing cold.
Oh, that's the best
Grandkids
way.
don't know any better.
And they don't care.
Yeah, they don't care. I promised to eat lunch afterwards. Okay.
This is grandkids?
Yeah.
Yeah, grandkids, whatever.
Sounds
You
about-
can have ice cream, cake, and whatever you want. Then I'm gonna drop you back off to your parents.
Yeah, exactly.
That's
It was fun. Good times.
Awful.
It's the best part. And you also buy them all the noisy, loud toys
Oh, I
that
was
require tons of batteries. I'm that kind of grandparent.
Sweet revenge.
Clearly. Well, I didn't even raise them. I didn't even raise children. I just went straight to grandma. It's awesome.
There you go.
Here's the drum set. Electric guitar.
You wanna play cymbals? Okay.
Here's a drum set. Have fun.
You're like, let's encourage their dreams. They're like, no, cut it out. Don't give them the.
The reality is though, because my husband's a musician and his son, most of the grandkids' parents they're all into music. So you want keyboard, you want this, you want that? They're all in for it.
That's awesome.
Yeah, good for them. Again,
Have your hand.
we can start 2 minutes early unless anybody cares.
Go.
So I say we're good to go. You can call us to order whenever you're comfortable.
I am comfortable and ready to call this meeting to order. Can we have a roll call?
Director Stanicek,
Here.
Director Leach.
I'm here.
Thank you.
Do we have any public comments? Anybody on board or any written?
We do not. Nothing was emailed in. We have no other guests on Zoom. So
All right.
just as chance.
So since we have no public comments or Zoomage, we'll get the meeting to the next item. Public engagement discussion topics. Is this where right to Teresa? Or is there something before that? Community events.
Pretty much under A, we'll generally start with Teresa. We don't have anything specific from the admin area on events, so.
Okay.
All right, Teresa.
Okay, thanks everybody. I'm joining you from home because I actually have been out with COVID. So if I seem a little foggy headed, excuse that, but I wanted to be a part of the conversation today. Oh, and I don't see the desktop. I don't know if it's my internet, which has been a little glitchy today. I don't see the report, but that's okay. I know what's in there. There was one thing that I realized that I should have added to this report. So I'm just going to mention it first. And that is a campaign that started last month called Be Part of the Conversation. And so it is a campaign to encourage engagement in our committee meeting and board meetings. So it has been running, we've had ads in the Village News, as well as about, each week before the different meetings on social media, a little graphic inviting people to the meetings either on Zoom or in person. And it will be added to our newsletter as well. So that is scheduled to run, I believe. So that is in the works. We can see some more engagement in these topics. Saying my internet connection is unstable. So I I apologize if you guys,
Video.
Yeah, you sound good to me.
okay, good. I just can't see, I just can't see the screen, over there. But, you can see, at the Wellness Center, we're all into our new offices, so that's good. Katya's, just getting fully inundated with all of our relationships and resources in town. And one of the things I see that position overall is just opening commitment and a different type of commitment to the community. So we're getting,
Teresa,
yeah.
can you hear us? Can you hear me?
Yeah, I can hear you.
So turn off your video and you will have
Got
a
it.
little more bandwidth. Yeah.
Okay. There we go. Can you hear me okay?
Yeah, we can hear you and we're showing the screen, so I'm not sure why you're not seeing the shared screen part.
Yeah, I keep getting, probably with the weather, I keep getting, messages that my internet, connection is unstable. So,
Okay, just letting you know, if you drop off, I'll pick up your report.
okay, sounds good. Sounds good. I'm going to try and, just make sure there's nothing else I can, okay. Let's see here. Oh, shoot. Okay. I still can't. I was hoping I could see the screen, but I can look at my notes now. So we had a great meeting with the CCHW that is getting a little revised with some new interactive activities. So we've got a great feel on how we can serve those organizations this year and prepare some programming for that meeting to meet their needs.
Apologize for the acronym soup. What is that again, please?
Good question. That stands for Community Collaborative for Health and Wellness.
Okay.
And that is a monthly meeting that has been in place for, for many, many years. And it's to support our grantees and the community at large, a chance for collaboration. So there's a lot of different organizations that attend it, including school districts, our grantees, other the county usually sends a representative. There's a whole variety of different organizations.
Okay, thanks.
Sure. So we have a good, plan for that for this next year. Last month's the Wellness Wednesday event had a good turnout, and we ended up with 4 people that were pre-qualified for the lifestyle change program. So, and on that note, Bianca and I just completed 16 hours of training last week to become a CDC certified lifestyle coach for this type of program. So it was a lot of great information, and planning is underway for the launch of that program. The date we're looking at right now is April 25th. And we're still, learning as we go along. So we have that goal date that we're tracking to hit for April 25th. And the feedback from the cohort we're a part of with Skinny Jeans, which is the organization that's contracted through the county to bring this lifestyle change programming to community partners to try and get it more available to county residents. So according to them, we are the most ahead of the game of the group. So according to them, we're doing good with our planning and slightly ahead of schedule. So that was good feedback. This past month, there was a presentation made to St. Peter's Church, to their women's ministry. And that was a great presentation because the majority of those people were not familiar with what was happening at the Community Health and Wellness Center. So that was a nice introduction to, a new segment of our population. So also in January, we had a private event. We had a quinceanera and had 105 people there. So at the center, and that went well. And Patty was, on board, kind of chaperoning the event. But if you can see, we had a lot of visits to the Wellness Center in January. Our highest month to date at 775 visits. And a big part of that was continuing to involvement with different groups meeting there, which I think is a real positive, because it gives us the chance to make an introduction in front of those groups to what is happening at the Wellness Center, make sure they know our calendar, how to find out, get on our website, and know what's happening. So just so you guys can know some of the groups, like Encore. We had the Good Dogs Service Canine group, and they had a big public graduation ceremony, Rally for Children, Angel Society, Garden Club, Tumble Creek HOA meeting. So those were, some of the groups that contributed to that larger number there. So I have a list of where flyers. So Mary Murphy did get back to me with her, what her CPR training for the month of January. She was able to train, I believe it was 140 students at Fallbrook High School that are part of the ROTC program. And we're still chipping away, trying to get the CPR training into the school district curriculum. So that's still, haven't given up on that one yet. Again, we provide the flyers physically, digitally. They are supplied to each of the school districts in town, the chambers, particular communities that, organizations that would have need of the type of programming we're offering. In terms of the Village News, we had one article. We ran 2 ads. One was for the Wellness Wednesday event, and the other was for our Be Part of the Conversation campaign. So our email marketing continues to go strong. We added 139 new contacts in January. And so for a net of 105 new contacts, all of our click rates and open rates continue to be above the industry average. So that is going good. And there's a lot of work that goes into collecting all those emails, but having those groups, again, this is another benefit of having different groups use the facility, because we're able to have them, sign in and have the opportunity to get them to opt into our email list. Danny's not here tonight. She's not feeling well, not COVID. So, but, we're continuing to, do our best with social media, and continuing, to see, some growth there. Our engagement rate with Facebook was really good in January, and some of the post reaches. So that's good. What she saw on her end was that doing a little reel for our Sugar Detective workshop really caused it to be one of the best performing posts. And so we're going to try and do more of those. And there's a little, if you didn't see it on social media, there's a little screenshot of the video that was done. So the only other comment that I have is with the putting the Wellness Wednesday event out there is also getting people interested in what we're doing in terms of other organizations. We continue to get more people approaching us to partner in the event. So it's getting us a little bit of visibility with other organizations as well. So that's my report. I don't know if you have any questions for me.
No, I don't think I have any questions based on the report. Looks like things are still kind of trending in the right direction and keeping busy and keep growing. That's awesome. All right.
I don't have any questions. I just want to say, I hope you're, we definitely appreciate you, still, attending the meeting. Thank you.
Oh, thanks. So I'm excited to hear what else is shared today. So I didn't want to miss it. Thanks.
Good. Okay, next topic, local newspaper outreach initiative. This is something I know we've talked about and but I want to kind of table that because I believe it's broader than just the local paper in terms of the strategy that I think we need to start kind of gelling around here, and I'm trying to figure out the best way to do that. But I'm just going to make a quick comment about this before we get into the outreach coordinator, because I think it relates to the potential objectives of this person might be going. But as I've sat in through now, I think 2 or 3 meetings, there's 3 themes that are developing. Why don't we have a hospital? Why do we have an urgent care that's not great? And what does FHRD do? Those are the questions that I continue to get, and certainly from the community responses and what we're seeing in some of the meetings. So I think there's some pillars there that we got to kind of really wrap our arms around in terms of the objectives going forward. And then within that, within the wellness center, the awareness and the outreach that's going on there, but how does this relate back to those 3 kind of pillars? And there's obviously, that's a third one, FHRD, what do we do? What's the wellness center all about? Why do they exist? Why is it a wedding venue? You know, those kind of questions that are coming up, but those are real valid concerns, whether false or real. And I think we have to start kind of putting together some communication protocols to kind of answer those 3 areas in my mind. I'm open to other ideas as well and what's been done historically if I'm way off base, but that's what I have observed coming into this. And I think there's an opportunity for, 2 or 3 crisp pieces that, whether they be through the newspaper or social media, but just addressing those things so we can kind of get those things off the table and really focus on the wellness center, what it can do for the community. So I wanted to throw that out there. I want to have some more discussions with people on that, get a little more depth in history so we're not repeating anything. But that's what kind of rises to the top for me. Those 3 areas that seems to be continuous questions. And if we can do a good job of answering those and we get them off those topics and onto the next thing, what's next? What's in the future? How do we gel the future going forward? And so that's where my brain is right now. And I'm going to try to figure out the meetings to get some more insight and turn that into actions going forward. So, and it's obviously going to involve this new position. It's obviously going to involve the social media person. And so that's where my head is right now. And Bill, if you want to add anything, I know we had a brief discussion last week on some of these things, but I see the need for action in terms of some of these communication pillars. And ultimately it's going to relate back into how do we get into our districts and have people understand how to get us, hold of us, talk to us, feel comfortable talking with us, making sure they can talk to us in terms of the language barriers that may or may not exist. So that's where my head is right now.
Yeah, no, I mean, I would agree with a lot of that there's definitely some communication, yes, overall issues that the districts have over the years, trying to communicate messaging, to the community in various ways. I think that it's kind of, Fallbrook's a bit of a unique situation. Live and use the community sometimes. I think a lot of people kind of miss out on some of the community news, some of the local aspect of some of the stuff going on. But I would definitely agree with that. I mean, I would be all up for, a strategy to, kind of push some of that proper information out. I think that, it's good for me, like seeing some of the social media stuff. I think that the Village News is cool. There's definitely a certain subset of the population and the community that reads the newspaper, the Village News. Personally, I haven't read it in 10 years. So, I've read a couple articles, you know what I'm saying, here or there, and I'll see their stuff sometimes online. But, I think that a lot of I see a lot more stuff like on forums like Friends of Fallbrook and just social media type things or whatever. So
Yeah.
I think we're kind of heading in a good direction, and I definitely be in favor of continuing to move that way and continuing to strategize messaging a little bit better, because it is sometimes a little bit confusing as far as what the healthcare district does and doesn't do, and what impact we make or whatever in the community, which is quite big. So
Yeah, it's kind of a scope, out of scope conversation of what things people expect us to do. And I think we need to continue to focus on our scope, not our out of scope things. And things get spun out very quickly for some things that are out of scope that aren't even part of our purview. But we need to batten that back down again and keep it within the scope of things that we offer. I think also the Village News, I was also envisioning, maybe there's an idea around it, a 3-part editorial type thing where we can get into the paper and talk about some of these pillars and just get some responses, and how many people are connecting on the news versus the social media. I think we need to understand kind of from these two positions potentially of where are we touching people and how do they like to be communicated to? And I think everybody's got a phone. The Village News is a subset of that, but the global side of this thing is, I think there is a strong push for social that we need to, kind of expand, whether it be Friends of Fallbrook or Friends of FHRD. Maybe we need our own page, like Friends of Fallbrook, that is a constant conduit of this kind of information. So that's kind of where, I'd like to explore this some more and turn these into, real strategies and objectives for somebody to go after and start measuring.
Yeah, I would agree with that, and I would just kind of add the caveat in there. In the past, I know that when we've worked with different, consultants that handled some of the social media stuff, it was always really disheartening to me when they would show a lot of their metrics that showed some of the touch and some of the reach of the post clicks and some of the stuff that was meant to kind of show impact. And hey, this is like, wow, look at all this stuff that we're showing. But in reality, it was impact of people that had nothing to do with the district or the community or anywhere that had anything to do with our district or services. So I think it's critical that we always kind of try to micro target to the community that we're going to be serving, and continuing to look for ways to find successful metrics to track that stuff, and not just kind of say, hey, 1,000 people looked at it. I mean, it could be 1,000 people in Arkansas and it could do absolutely nothing to us. So that's kind of my 2 cents on that.
No, totally agree. Okay. Enough on that probably unless there's some more questions or comments. All right. Next topic, the job.
Yeah, so the potential, and then obviously, the position was essentially born out of not only our history of seeing these communications falter, but also the fact that the special meeting we had on the 7th, thank you, really pointedly made it clear that there is a large component of our population that are not hearing our messaging. So the position that I've outlined here really follows what I'm seeing from a number of different kinds of entities like us that have a position that is not only communications, but is also outreach. The staff has been doing outreach events whenever we can, whether it's Teresa or Tracy or me or Judith or you name it, we show up. But it's not always possible when everybody's wearing a couple of hats already.
Sure.
So the position really is outlined. It's pretty much clear in there what I've added. Obviously, this draft is up for as much editing as you feel you'd like to make.
A few pencils.
Yeah. But the primary purpose of this position would be an in-house coordinator that would do not only our community tabling events, but would support Teresa and I in public speaking events, would attend local chamber, would attend a number of things, But this position would also be flexible enough that this is the person who's attending those weekend events. For example, we had this conversation with the team here about somebody going out to Ingold Sports Park during the Crazy Kid Saturday and being able to be there and say, hey, these are the programs we have for your families, so that you folks can come here and be part of this. Additionally, besides that very grassroots, keep it local, like Bill was saying, we want to see some local impact. Our social media is essentially handled by, if you count on it, a part-time person who works at the fire district, and Danny has done a good job, and she's the second person to hold that position. The challenge is that Teresa has to feed her the content. So Teresa or myself or something. So it's sometimes a gap between what we're doing, because we're too busy doing the job to sometimes be timely in getting her an opportunity to get photos or something of that nature. By having our own potential communications person, they'd be immersed in our culture, be able to know what the schedule is, be able to do some quick videos, be able to do some of those faster pieces. So while it is another staff person, I think we have grown to the point, and the wellness center metrics that Teresa just gave us is showing how it's growing even without a strong outreach messaging. It would be nice to be able to have that coordinated conversation that you just referenced, Mike. And then I'll point real quick, besides the job position, I also added into the packet the one pager that had 12 notes on it from a couple of people that I met after our January 7th meeting. And those questions are really indicative of the misunderstanding of what's out there. I met with those folks for about an hour, and of the 12 points there, I think 10 of them, we've either done it, are doing it, have a plan for it, or are things that are clearly outside the scope of the health district. So all of that in mind is what has gone into the generation of this position. Did my due diligence at looking through various other hiring platforms to identify a pay range. So I've got that on there.
Is this budgeted already, or is this a new
So-
incremental add?
This would be an incremental add. Now, here's kind of the good part in the budget magic. The district for this fiscal year had a substantial line item under district direct care services. And that was our position last March, April, when I started doing the budget, because there was a lot of unknowns about what kind of services would come online at the wellness center. There was a concept of this lifestyle program that we might package off the shelf and start, a different MOU that we thought we'd have with our federally qualified health center. Those things have not come in play. So in theory, we have extra money, that's air quoted for those of you who can't see me, air quoted extra money in the budget that could backfill or underwrite this position if we chose to do it in this fiscal year.
Got it.
I know that's a long answer to a short question.
Fair enough. No, it's all good.
So yes, mostly,
Sort of.
sort of. It depends,
It's a bucketing.
right? It's bucketing.
Yeah,
It is 100% bucketing. So we have enough money in the bucket.
gotcha. So at this point, there's not something that would be slowed down, stopped, that was already agreed upon, or is it still, there's some potential trade-off decisions there between this?
There's no trade-offs.
Okay. All right.
Yeah, so for me, you know, if we were to do something like that, there'd be a slight trade-off, is I wouldn't be in favor of continuing to pay for the position that we're co-opting with the fire district. I'm not sure what the limit is on that or where we're at on that, but I'd hate to be continuing to pay for something that we're not getting, and we're having to be forced to create a new position just to kind of do the same thing.
Yeah, sorry, Bill, I forgot to mention,
Yeah.
the North County Fire position the grant agreement that we set up with them when we did this, it's pretty much a no harm, no foul. So we can just give them a 30-day notice that we plan to no longer continue with that agreement. Then we can essentially cancel that level of agreement with them. I did a brief conversation with a couple of folks over at North County Fire, letting them know that our needs are probably going to go beyond what we have with the grant with them. They completely understand, and they would decide on their own what to do with that position over there.
Gotcha.
So we would not be beholden to continue to pay for that position there after a 30-day notice. So sorry to mention that. I didn't mention that, Bill.
Okay, just a thought, is that is that also true of the other position that we pay with the fire district?
That is also correct for the senior medical services officer. Yes.
Okay. Yeah, I mean, I'm just, to be honest, I've never been a big fan of that arrangement. And, obviously the district's grown quite a bit here since my first time on the board. I think there was 3 employees. I'm not sure exactly what the total is now, but it's definitely growing. I'm definitely knowing that there's, like, I guess, more job tasks that are going on and different things that we're trying to do. But I would just say it's always a thought in my head is that the more money that we spend on stuff like another staff member, that's directly going to affect our ability to write grants or do programming. So I mean I'm open to discussing it with the board or whatever, but I would just say I'm always just kind of a little bit concerned about that. I mean, especially with discussions of some of the upkeep in the buildings going in the operation budgets and some of the growing costs of things. I always just kind of, my vision for the district is providing services and doing good things for the community and funding the grants that we fund. Obviously, there's a lot of stuff that we're doing right now, but I'm always kind of concerned about that number. So, I mean, that's kind of where I'm at. But I appreciate the presentation. Like I said, if you guys are all good with it, I'm definitely good to advance it to the board meeting and discuss it on that level and see what everybody thinks. But we definitely have a dearth of good information going out to the community right now. So maybe a little rearrangement there is in need, but that's kind of where I'm at.
Can I make a point to that?
Yeah.
Bill, I think when I was newer to the community 4 years ago, I mean, for people who are entrenched and who have lived here for a long time, I think people here are aware of what we have going on. But when I was new, I had no idea where to locate any services for like myself, children, school, education. It was super hard to find that information. That was one of the things I mentioned to Rachel. Like, when you are new here, it is really, really hard. Even if you join like the newspaper, like you get the information off of there, there's really not much available. So when this position was mentioned, I was like, hey, that would help a lot of newcomers because there's a lot of families who don't really know.
So Bill, to summarize what you just said, is there a concern with the funding level that is growing from a staff position versus the funding that could be used towards services and grants? Is that your fundamental statement there? And if that is the case, how is that reflected in the budget that's been approved? I guess because that's the trade-off, right? I mean, if you're going to throw money towards staffing, it's less money toward grant.
Yeah.
But then you're covering basic needs to actually get the services used, funded, and done through the grant process and what we're doing. So I just wonder, do we get an inflection point where we're kind of pressing over the budgets that have been allocated for these different areas? Is that your comment, basically?
Yeah.
Okay.
I mean, I'd say like
Breaking up, we're not hearing you all the way there.
Offering, it's not like it's gonna. Oh, I'm sorry. Can you hear me now?
We can hear you
That's
now.
better, thanks.
Okay, you good?
Yep.
Okay, so yeah, so I mean, with the level of funding for that position, I'm not like terrified of doing it or anything like that, or think that that's like the straw that breaks the camel's back. I mean, I would just say like overall, I think it's something that we need to watch. You
Yep.
know, like I said, every dollar it's really a trade-off. I think my comments probably like alluded to it, but I've never been a big fan of the JPA arrangement. I never thought that we really got a lot of bang for our buck for what we paid. And you know, I mean, if we're talking about possibly rethinking other money, I mean, and putting some of these positions in house, I mean, I would be in favor of that. But you know,
Okay.
that's all. I mean, I don't have any, like I said, like deep fears about the level of spending or anything like that. When I first came on, I think it was a general manager and like 2 employees. So, I mean, Rachel, what's the number of employees that we have currently?
So we sit at 8 right now, and you're right, we were at 3 for a long time. And then the bookkeeper and Medea's position were created under Bobby. So we went from 3 probably with 5 with Bobby. Side notes, footnotes there. And now we're sitting at 8 with the opening of the wellness center. So.
Understood. Yeah, so I mean, I think like where we're at isn't like terrible. Like, and I, you know, I don't want to give the impression that like, you know, I don't appreciate the staff. I think the staff that we have right now are doing an amazing job, and I'm you know, glad to see all of them in positions and love what they're doing. You know, but like I said, we've had continual discussions about the development of the wellness center, some of the expenditures that we've made, potential trade-offs for reducing grant funding in the future. And I just don't want to be an organization that grows to the point
Lost Jeff. Yep. I think we just, we
lost him. So I'll add a little bit to what I think Bill was indicating, because I've had this conversation with him in the past. We do need to make sure that we are being very cognizant and aware of how much is going into district admin and staffing versus making sure that we have funding available that goes to grants and services. 100% that has to be part of that big conversation.
There, Bill?
Yeah, sorry about that. Yeah, I got like an emergency broadcasting alert or whatever. But I was just saying that I don't want to get to the point where we grow to the point that we reduce services, you know. So long as we're mindful of that, you know, I think we'll be in a good position.
Yeah.
I agree. And I think my philosophy has always been, if we have a set of things that we sign up to do, and we're unable to suddenly to do them because of staffing shortages, and that creates a position that's well-defined and can be described. And then if the budget supports it, then you move forward. If it doesn't, then you hold it for the next year. But I think it always has to come back to something that's not getting done that has to get done. And if we can identify those things, that should then turn into a staffing description. So that's how I kind of view these types of things and justifying the additional cost.
Yeah.
Because it's an unmet need that has to get filled. So, okay.
Definitely.
So the next step on this is, you want additional edits and then board discussion?
Yeah, if you have any thoughts or changes you want to put onto the position, shoot those over to me, and then we can add that into the board packet unless you feel that this needs a rewrite and needs to come back to committee. That would be
Minor tweaks from my perspective, so yeah.
okay. Yeah, if you want to, so Bill, if you
Yeah.
have any edits, feel free to drop them into an email to us. Mike, if you want to hand those to me. What we'll do then is we'll go ahead and update any of those into this, and then we'll bring it to the March meeting as an action item as a recommendation from this committee to consider the development of the outreach and communications coordinator position.
Sounds good.
Awesome. Thank you. Yeah, I'll take a look at the document tonight and let you know if I have any thoughts.
Okay.
Excellent.
Awesome. Thank you.
Yeah. Anything else on the position?
Nope.
Not for me.
All right. Public forum.
Yeah, so I alluded to, this, the one pager that I received on the 8th, February the 8th, I'm sorry, not January the 8th. And besides using that to help identify some of the pieces for this potential position, it also pointed out the fact that, Bill was here during the Bill, did you come in at the closure of the hospital or after it was already closed? first-
Sorry, am I muted or you can hear me? Oh, no, I'm
No,
good.
I can hear you, yeah.
Yeah, no, I came on after it was closed, but not quite when it sold. So when I came on the board, it was just kind of sitting there and costing $25,000 a month, sit empty and be an eyesore.
Yeah, okay, that's what I was recalling. Basically, I know that during that time, which is about the same time I came in, there's a lot of community conversation that had to do with, why don't we have a hospital? There's a lot of communication around, we need a 24-hour urgent care. On those two particular issues, Bill, I know you sat through them as well. We did a lot, the district did a lot of outreach at that time. Again, how much impact we were making then is hard to gauge. But because it continues to show up and we don't have good collaterals from those times, it makes sense that it came back. Besides the third part, which is what does the district do? It makes sense for us to maybe go back and revisit some of these things for folks who were unable or didn't know to attend some of those things from back in the day, to create smart messaging around it, that can live in a perpetuity, right? So they find the website and go, where's my hospital? Oh, okay, I get it. Why don't we have, okay, I get it. Instead of us having to recreate the wheel from scratch.
Mhm.
So public forums, I think it might be smart to get something scheduled. March is not gonna happen, so we're probably talking sometime in maybe late April, first part of May. With the district's grants, we're really probably looking closer to a May timeline.
Well, you might get more pull with the grants being done, right? In terms of at least being able to talk about them and
Sure,
add that as part of the poll.
sure, yeah.
Because that's a key aspect of what we do.
Absolutely, yeah, because we'll be able to publicize those grants that are being made forward for the next fiscal year, as well as to be able to highlight 20 years of grant making.
Right.
At over $13 million invested back in the community.
Those are
So
good headlines.
yeah, that should generate a little more interest.
Yeah.
So that's what that particular line item was about. So I'm gonna go ahead and
Okay.
start kind of drafting an outline with that. I'm assuming it would probably be in our best interest to either make this a weeknight or try to do something on a Saturday. Saturdays are tough when you're competing with families.
Yeah, little things that are.
Yeah, so if we could do maybe a weeknight with a very light amount of food available. We don't want to feed people just because they want to get fed, but we do want to make sure that anyone who's giving us their energy and time is being, able to do that and not miss family dinner kind of thing.
Would both be something to think about? I mean, I don't know what kind of a draw we've had historically on weekend versus weeknight. I understand both sides of the argument.
I don't think there's a way for us to be able to give you the historical on that.
Okay.
I would say anecdotally, I think we've had better outcomes, better luck. Making up words now, outlook. For an evening weeknight, as long as it's not running too late.
Max hour probably type of thing.
Yeah, we can have it be a little bit public, open house format so people could stay. I would not recommend we make it a formal meeting because then your hands are tied
Right.
in the agendizing. So I would say this is something that is primarily staff run. We could probably have the committee, the two of you, available on site just as communicators to the public. but I wouldn't recommend we do any more board members, otherwise we
Turn
have to
into a
make it
meeting.
into a meeting.
Gotcha. No, I agree with that for sure. It's gotta be coming in.
Yeah,
And that
Well-
all sounds good to me. Yeah, no, that all sounds good to me. I think that the timeline sets up good for us to get a good run up to potentially getting some people out. Just a thought, I'm not sure if we've tried it before, but I think it might be a good way to get the word out. I know that a lot of the local groups, they put flyers out to the school districts. I think that here in town, you have to like print out your own flyers and drop them off, but it might be a good way to ensure that we're getting, flyers in the hands of all the potential families to come out or whatever, and give them I don't know, maybe a little informational about the district on there, and say, come out to the community forum, because, I mean, we've had some good, outreach sessions in the past, but it'd be great to have, as many people as possible to come out and give their 2 cents.
yeah. Well, and Bill, I'll let you know, on the school districts, they no longer actually allow you to give them paper flyers. You have to
Okay, is
actually
it just
go
a
through, yeah, you gotta go through Peach Jar or whatever their
Okay.
digital format is. We
Yeah.
learned that the hard way. We can make some larger posters to try to provide to the districts to see if they'll at least post it in maybe a more public space, something of that sort, but we can do a little
Yeah.
more push on it than we do just for our regular monthly items.
Yeah, that'd be great. And I just say, like, on the subject of feeding people, giving them stuff, I'm all for it. Like, I know that in the past when we've given out a few prizes, or said that we'll have a couple snacks or some coffee or something, it's definitely increased the amount of people that come out, and for the amount of money that it probably costs to buy a couple of those things, I'm sure that it's well worth it.
Okay,
So target May timeframe.
yeah, probably
Rough agenda.
early May before
Yeah.
kids get out of school
Yeah, for sure.
and such.
Yeah, so target kind of a rough idea of grant update, wellness center update. And
Yeah, and I would recommend we
whatever else.
actually hold it out at the wellness
Oh, yeah.
center. obviously, I think- Yeah,
Yeah.
yeah,
Great,
Absolutely.
got room out there too.
yeah, plenty of room.
Yeah. Okay. All right. I think just is there anything else on this topic?
Not
Okay.
for me.
No, I think, yeah, let's get it on the calendar, and I think for future agenda items on the board, I'm not sure, kind of looking at what's coming. We've got a lot of discussion and topics around the wellness center and the budgeting, the capitalization of that, and but I do want to slip in, I think, kind of some ideas on the social strategy going forward, social media outreach.
Yeah.
Kind of around these pillars, or other ideas you have in terms of just framing it and turning it into actions that we can start going after here, because whether it's digital or paper, I'm not sure.
And or both.
And or both, but I know everybody's carrying a phone for sure. So I think,
Yeah.
let's test that as the primary channel. And then other channels will be backup, but I want to develop the point where we're more digital. I think that's where everything is right now. I'm seeing in my own business. I mean, we're not handing out flyers anymore as realtors. We're handing out, we're on the phones.
Yeah, I mean, we still have, a very grassroots, old school.
Sure.
With flyers.
I get it.
We know that works at the markets and things. It cannot be the only strategy, obviously.
Right.
But there's probably some guidance you could provide us, with your skill set, to help us create a better plan and strategy, and identify those areas where we could maximize the efforts a little more.
And I think from a flyer perspective, we know how many we're sticking out there, and we know how many we refill. So, I think there's some, I know it's a little work, but we print 500, we put out 500, we take back 250 in 5 months, then we say, okay.
Yeah, the challenge is, a lot of the places that we put it, Tracy will go back and she'll clean it up monthly.
Right.
But some of those people will just throw things away. They'll see that it's a dated event and they're like, done, I don't want this in my office anymore, or they won't accept it at all anymore. And we've seen that with
It's good.
a lot of the physicians' offices. They're like, don't bring me that.
Right.
I'll take one piece of paper and we'll tell our patients. No, you won't.
Yeah.
Liars, that kind of thing. So,
Well, we said a similar thing in the chamber. We're handing out flyers all the time for the big events, and we know some stick, some don't, but you do have to cover all of it, but it is transitioning.
yeah.
Yeah, we know that. Cool. Any other?
Yeah, just for me, I was just, while I'm thinking about it, we're talking about upcoming, potential public relations, opportunities. Do we have any sort of plan for doing anything for the Avocado Festival? Are we gonna have a booth, or do we have any sort of, idea for, doing anything there? It's a good opportunity with a lot of people.
So our only challenge with the Avocado Festival is the fact that 90% of the people who attend are people from out of town. So having the staff resources in that has been a bit of a challenge. Teresa was there. Teresa, is that the one you went to last year with North County Fire?
Yes, yes, it was.
Do you want to talk about that experience or?
It was and is a lot of out of town people. That's true, that come to the event. If we were to do it, our location with North County Fire was good because people were coming in to participate in other things there. And we tried to build it up like to local residents. We did a social media campaign, like to come and get a pair of sunglasses, and we gave out sunglasses and tried to share it out there. But it by and large was for the everything that event entails. It's a lot of work for out of the area residents.
Okay.
And we will also mention, Teresa, how many of the board members came out to help you or show up?
One. We had one board member.
Just making that observation.
Yeah, it was me, and he came out for a few hours, and then it was me the whole day because there was, it being a weekend.
Commit or not? Yes, I hear you.
Understood. Yeah, I mean, I don't know. Like I said, I would be, interested in potentially trying to do something. I mean, I know that there's definitely a lot of out of town people, but it seems like every time I go, I see all the people I know from around town, like that I see, or haven't seen in a while. So, like I said, I don't know. I think that, everything approach is kind of where we need to be, and just kind of attack every sort of opportunity we have right now, to kind of continue to shape that messaging and kind of get people to understand what we're doing, and like what we need from them. So
I agree with the everything approach that works. So throwing the bucket of water out there, and I think I don't know how much history there's been on what is actually sticking and not sticking. So I'm also about putting the effort toward things that need the highest possible, lead to the highest possible success. So that's the other aspect that I'll always be looking at too, is put the money where the biggest gain is going to be. And we got some areas we're going to have to grow in, I think. I think our social media presence continue to be a growing aspect of it. I think there's community events that we need to target, whether it's the Little League opening days or it's, things like that. I know my grandsons are opening days this Saturday for the big Little League thing. And I don't know if you have anything going on there, but that's direct. And it's something we can maybe target down the road to say, hey, that's community for sure.
Yeah.
And smaller group, which you can have more interaction with.
Absolutely.
And it's very relevant.
Yeah, I think there's absolutely ways that we could have a presence and provide a promotional branded item that is relevant to that population, helps get the word out, makes it visible. Not to beat the dead horse, but this comes back to that position. I will tell you right now, we have two fairly big groups that are meeting out at the Community Health and Wellness Center this Saturday. Because Patty is not feeling well, she will not be there. So now I have Tracy covering it because she's the only staff member who's available. And that's going to put her into a 7-8 hour overtime day. Now, there's no other option other than no one's at the center for those two large groups.
Yeah.
So again, I couldn't even if we thought we could find a way to be at, the opening day for Saturday, I wouldn't have a person. So that's
Is
just.
that historically something that board members would attend or could attend, or I'm just asking the question, I mean.
Absolutely, you could, yeah, during, sometime in 20 to 21, sometime in that blurring of time, we did a few more tabling events where, Tracy and or Teresa went out with Stephanie, because Stephanie was, able to do some tabling events. Both she and previous, board member Kate, did a couple of events, but they could not own it. Meaning they did not own it, I should say. So I still had to have a staff person go to take the easy up, to take the tables, to figure out what flyers to take, to know what to say.
Okay.
That is not something that you can typically just toss on to a board member and be like, good luck, Mike, hope it all fits in your truck. Because it's still gonna take staff a partial day
Okay.
to assemble. Not that we can't, but it's something that we need to build into the process of.
So that's potentially something out of this position that would be,
That's the expectation. This position would be like,
okay,
good luck on Saturday.
it's good to hear
Yeah.
the history though, because.
Yeah. And that can be something that we can do in a follow-up meeting to get into some of the
Yeah.
nitty-gritty of what have we done.
Yeah.
I can't really talk too much beyond what has happened since I got here. I can tell you a little bit about Bobby's earliest days, because I would have been a community member with her, but
I'm missing recent history, because
yeah, recent history.
it's all changed anyway, the way information flows, I mean, it's
Yeah.
almost irrelevant, I would only be looking last 2 or 3 years for any relevance of
Yeah.
trend,
And
and even that's short term, I mean, it's probably
and
last year.
it's
COVID.
wobbly because of COVID, right?
Exactly, that changed everything, so we're back on a
Changed all of
different page again,
Yeah.
okay, very good. Any other comments?
I just have just one last thing. I just want to just add to what you said about the opening days. I think those are really great opportunities. Like those are the sort of things that we should be really attacking. Going to something like that and handing out some water bottles would get us a lot more goodwill than, an opinion piece in the newspaper, something like that. I could say like from one of my earliest times on the board, I was volunteering at the elementary school district, does something called the Don Dornan Games, which is basically just like a track and field meet type thing against with all the schools. And it happens at the high school every year, and there's tons of kids. And I was there volunteering, and I got just some cases of water from the district, and just passed them out myself. And I could just, the kids were pumped. The people were excited to have the free waters. You know what I'm saying? Like, I didn't get a whole lot of questions from the kids about what the district does or whatever, but I just thought like things like that are just excellent opportunities to really just let people know who we are, put a face on the district, and to, like potentially give somebody some information about what we do and get them to come back and come to one of our events. So I would just say great opportunities out there for sure.
Yeah, even Bark in the Park's coming up in mid-March, and I don't know how many people show up to that. It's different community. So,
Yeah.
All right. I'll figure out, I mean, that feels like in a Bark in the Park, it's another event, yeah, with kids and dogs and community thing. I guess a pretty good pool. I haven't seen how big it is. I just heard about it, so.
Yeah, and there's arts in the park, there's bark in the park, there's a lot of those.
There's
community
movies
events.
in the park.
Yes.
Are there movies in the park?
There is some at Lila for families.
Yeah, so, but those are the kinds of events that a tabled event is very possible. I know Teresa and I
Time and
have
energy.
tried to build a few in. We went to the Harvest Fest. Harvest Festival last fall. Bianca, Tracy, myself, were able to kind of do that. And Tracy's ideal at it, but we also need her to do her job here. That's important because
Understand.
Bianca is now beyond full.
Okay.
It's just, what it takes to get stuff out there, but we have all the resources. We have a truck, we have the easy up, we have the supplies. We just need the person.
Gotcha. Well,
Sorry, I just keep beating that horse.
No, I get it. I mean, it's but, you know, we hear all these different things to go do, but, somehow, I mean, there's another agenda topic here for the board, I think, of just
Board presence.
what is
there
the marketing strategy? And what are the elements of that strategy and actions that we need to take?
Yep.
And there's all trade-offs. It's a limited resource
100%.
bucket. So now we say, okay, what's the big one? So for me, that would be the first question is, what is our strategy? What are we trying to achieve? And that's why I always get to these pillar conversations, because there's always 30 pillars. What are the top 3? And what are the actions in the next 3 months for those top 3 pillars? And what are we going to complete and what do we learn from it? And then we're not going to do that again because that was boring and it didn't work.
Right.
So that's kind of where my brain's wrapping around here.
Yeah,
And I like to help in any way I can. So,
well, I like the fact you already pointed that out in a simple roadmap now. We just need to go farther.
it's just, it's go. I mean,
Yeah.
activity and accomplishment drives massive acceleration. So that,
Absolutely.
and if people are feeling good about it, that just builds fast and the momentum goes crazy. So that's what excites me. So. All right.
Good deal.
Do I get to hit the hammer now? Is that what this happened? I get to adjourn the meeting?
You can adjourn the meeting.
Done.
No, to hit yourself in the head, crazy. Yeah, you're gonna have to hurt. No. 6:27, we are adjourned.
Thank you.
All right. Thanks, everybody.
Better.
Thanks.
All right.
Bye-bye.
See you guys later.
See ya.
I'm so tired, I was like, I cannot see.